Welcome everybody to get to know your body's aches and pains. So today we're going to be doing a demo treatment for the low back and hip in combination. We're going to be using the floor, these two balls, and possibly the wall. We'll see how far we go. But first things first. As I stated before, especially when it comes to the demos, I was a little bit fearful of putting these videos out because if you have any underlying conditions, for example, hypertension or diabetes, or if you have any other injuries, you don't know if your vertebrae are out of alignment, if your hip is out of alignment, any other kind of underlying issue, you really should be seeing a provider first. That could be a massage therapist, trigger point therapist, chiropractor, physiotherapist, or a doctor, to find out a diagnosis of why you have low back and hip pain, because it could be something in particular that you don't know about, or it could be something as simple as trigger point therapy, like trigger points that you can do the therapy and do some treatments on your own. Also, I wanted to let people know is that with pregnant women, it's a given that you're going to have low back and hip pain. Your hips are moving apart and your muscles are guarding, so you are going to be in pain at a certain point of your pregnancy. But at no point are you able or allowed to do any kind of treatments to your low back or around the sacrum area. So I highly suggest that if you're pregnant and you're in pain and you want to get some of these treatments, you should be seeking a professional first. So now that I've done that type of explanation, let's get down to business. Grab your two balls, boys and girls, and we're going to do some treatments. One sec. And we're back. Okay, so we got the balls, we got a floor, let's hop to it. So if you want to treat your low back, then your low back muscles are actually just above your hip muscles. So if you cradle the hip bone, and you see it, whether you're standing or laying down, cradle on both sides of the hip bone. Anything above that to the 12th rib is your low back muscle, the QL muscle. Anything below the hip down is your buttock muscle, hip muscles. So just so you know the difference, I get a whole lot of my low back hurts, and they're talking about their bum. That's the bum, the hip, not the low back. Anyways, let's get down to business. Okay, so you're gonna first place the balls on the low back muscles, on the QLs. And this is after you've already found out from the doctors, providers, anyone that you're okay to do this, okay? So, grab your two balls. There's your hip. There's the balls. You want to keep your feet flat on the floor, so that way you can steady it, because it's going to hurt at first. It's going to feel like pain, tender, or sharp. Those are normal responses. So, you're going to place the balls in there. Have your feet here. And then slowly, at your comfort level, let your body relax into the balls. I already did a release, so my hip's already dropping. But you'll know, so I'll start off sharp, but then as it's gradually releasing the trigger points, your hip will just drop down, and you're not going to feel pain anymore. That's how you know that it's been released. Now let's get into the hip muscles. So you just want to go lower, again, and relax into it. It's going to be a little bit painful, as I said before. Just lean back, hold until the pain goes away, or a maximum of 90 seconds. So you can attempt this every 5 to 7 days, because there are a lot of trigger points in here. You could also move it more off to the side and just kind of go down. You can do one by one. So there's going to be muscles on the side here that you can do, but there's also a technique that you can do up against the wall, which I'm going to show you that next. So this is just a quick demo. One sec. And we're back. I love pause on these phones. I don't have to edit. It's so fun. Anyways, so, okay, now we're standing up against the wall. I'm going to show you now. So again, hip, bone. Anything below the hip bone, it's just your ilium, to be corrected, as your buttock area. Anything above, low back. So now we're going to grab these balls. Again, you can do one at a time or two. Depending on the size of the ball or the size of your booty, you can do this up against the wall. So I have a flatter tush, so I'm able to do this. Anyways, so again, same concept. Place it on the muscles where it's tender. Hold back comfortably, breathe, and let it release. Okay, with the hip, you can do one or two. Now your hip muscles, you're gonna get all along the side here, so just choose a spot that's tender. You'll find it, okay? Or to the side. When you find the tender spot, hold and rest until that pain goes away. So that's your video, folks, in regards to treating your low back and hip. So this time my cats did not come in, but wait 1 second, guys. This is my little rascal baby, so if you heard scratches on the post, this is her. Until next time, guys, see ya, bye.